Okay. Good afternoon, everybody. Adjust this podium a little bit. My name is Peter Zanoni. I'm Corpus Christi City Manager. And is the microphone on? Doesn't sound like the mic's on. We're going to take a... This is Peter. Okay. Oh, there we go. Does it sound different now? Okay. Well, sounds like our audio's on. We're on? Okay. All right. Well, I'll just repeat just in case, but Peter Zanoni is my name, and I'm Corpus Christi City Manager. Today's our daily briefing for a COVID-19 update for the community. It will be three people talking today, myself, Annette Rodriguez, our Public Health Director, and then Nueces County Judge Barbara Canales should be attending as well. Mayor Joe McComb will not be with us today. So we want to thank the community for continuing to watch. Our viewership continues to be high. We want more people to be informed, and I know those are some of the comments we see where we have about 500 people watching at least through Facebook, but there's 360,000 people in the community. And so I think the consensus amongst folks that are working in this area is that the facts are here and the methods to not get COVID are known, but we need more people to be aware and to follow the advice of the medical and science professionals. And so the more people watch and the more we talk to our friends and neighbors and colleagues and churchgoers, the better. So we appreciate those people watching and you sharing the message with the community. And we appreciate the networks and our local newspaper covering our press briefings and for covering them again today as well. So what I'm going to do is just go through the statistics, the number of new cases, deaths, how the hospital situation is looking in terms of number of patients and that type of thing. And then we'll have Annette give us some information on social distancing and other health information that's helpful to the community. So today we'll put up a chart here. We still have a high number, 343 additional new positive cases today. That is less than yesterday. Yesterday we had our highest number ever at 445. So it is a decline, but it's nothing that it shouldn't drive any change in our behavior, right? It's just one day and it's still a high number. In fact, it's the fourth highest number in the past several weeks, that 343. And it's higher than our 7-day average. The 7-day average is 320 cases a day. And so this surpasses that. It's the fourth highest number. And it shows a trend of increasing new positives. So while there is a decrease, we don't want to be excited about it necessarily, and we certainly don't want to change the positive behavior in terms of social distancing, wearing a mask, staying at home as much as we can, keeping our hands clean, and not touching our face. We don't want to stop those things because of today's number. Let's look at, let me see. Okay. The next thing we're going to look at is our recovered rate to active case rate. So today we have 4,730 active cases in the community, and that's a lot. We have 493 recovered. The active case to recovered cases or to total cases is 91%. So the majority of COVID-19 cases in our area are persons that have active COVID and they are not recovered. But 493 people, an increase of 30, have recovered since yesterday. And then yesterday we had 35 deaths. There's 2 more today. So our death count goes to 37, as you can see in this graph today. The number of persons in the hospital has increased about 10% since yesterday. So yesterday we had 302 persons in the hospital. Today it's 332. And we're getting a lot of feedback, and we're glad the community tuned in to yesterday's city council meeting. We had Annette Rodriguez and Hillary Watt, who is the CBRAC, the Coastal Bend Regional Advisory Council, who manages trauma and hospital care for a region. And I think a lot of people for the first time understood the message, which is that our hospitals are at max capacity and it's becoming more and more of a dangerous situation, life-death situation. And so we appreciate those persons that may have tuned in for the first time, and we like the comments and the feedback that we're getting. That helps us know how to help the community. So we appreciate the feedback, and we appreciate people watching yesterday. So a little bit of good news on the ICU patients. While the hospitalizations are up, the numbers that are recovering in ICU has dropped a little bit. So we have about 10 fewer in ICU today than yesterday, but overall the hospital count is up, as you saw on that prior slide. And then the number of deaths, we had 2 additional deaths, as I mentioned a moment ago. So our death total since the beginning of counting this is 37. Yesterday it was 35, and you can see a lot of the deaths have taken place just in the last couple of days, which is a sad situation. And then we're still tracking kind of the 7-day average and the daily versus that 7-day running average. So this is on testing. It does show a little bit of a dip down here. That's reflective of these days here when we didn't do as many tests as we had the prior week because we had less supplies, but we are getting supplies in, and we do appreciate our state delegation that has been relentless in working with the state to get our supplies, especially the ones that we need in the lab to actually conduct the analysis. And so we have received supplies this week, and we thank our delegation, state legislators, for helping us. We'll have enough supplies for testing this week and next week at our Tuesday, Wednesday, Thursday test events. And since we're doing the analysis, we get those results within that same day, which is good. So this shows our running average. The 7-day average is about 350 tests that we're doing a day, all testing entities, the city, hospitals, commercial labs, and so on. And then the number of cases, this shows our chart on the number of cases. You can see the daily number of cases and the 7-day running total. Our 7-day average is 320 new positives every day. That's based on the 7-day average. And we do like that drop that we're seeing today, but we're not being super optimistic in terms of it continuing to drop. The overall trajectory is continuing to go this way, but we are mindful of the interventions that have been put in place by the state and the county and the city. And those do take about 12 to 14 days to see an impact on numbers. And so we're hopeful that those will have an impact on our numbers. Okay, so that concludes the statistics. I don't know if we have a slide on the testing. Is there one more slide? Okay, good. Just a quick reminder on the testing. Today, the National Guard did testing at the Borchard Center, the Borchard Fairgrounds, I should say. Tomorrow at the ABC Center, the National Guard will be there. And then on Saturday, they'll be back at the Richard Borchard Fairgrounds, County Fairgrounds. And their testing is free, but you do need an appointment. And so the numbers here on the screen, the 883-2400. The Health District, as I mentioned, continues to test. Our plan now is 3 days a week, Tuesday, Wednesday, Thursday. We do have a backlog of persons waiting to be tested, and so those persons are notified via a reverse alert telephone call or text message. And we're doing about 200 tests each of those days at the Horn location, at our health center location. That may change soon to our Greenwood Senior Center and Recreation Center, but for now, continue to rely on that Horn location. That's where the health facility is. And so if you want to get on that list, you want to call the 826-7200 number. And then we do have a couple of nonprofit type organizations doing testing. The Wellness Foundation, the Coastal Bend Wellness Foundation, and the Amistad Clinic is here. And so you can see their numbers on the screen. The Coastal Bend Wellness Foundation, 356-9572, and Amistad's 884-2242. Those are both in Corpus Christi. And they've been great partners with us and the county in getting more persons tested. And then several private places to include the CVS Pharmacy and Christus Promptu Care have, as well as Physicians Premier Center, have testing. Those are by appointment as well, and that is by fee. You have to pay unless your insurance covers some of it. And those numbers can be looked up by looking up the actual entity. They have numerous testing locations. Okay, so that concludes my portion of the presentation. Gabby's going to translate into Spanish, and then we're going to have Annette Rodriguez come up from our health district. Thank you.
Las cifras más recientes indican que en las últimas 24 horas se han reportado 343 casos confirmados por el coronavirus, haciendo un total de 5.260 casos. 493 de los 5.260 se han recuperado por completo. 332 personas se encuentran actualmente en el hospital. 93 personas están en la unidad de cuidados intensivos. 4.730 casos continúan aún activos. El día de hoy se reportan 2 fallecimientos, haciendo un total de 37. Contamos con suficientes recursos para llevar a cabo las pruebas de esta semana y la próxima semana gracias a la colaboración de nuestros legisladores. Las pruebas del día de mañana por parte de la Guardia Nacional se van a llevar a cabo en el American Bank Center. Esas pruebas son gratuitas, pero debe de contar con una cita. Junto con el departamento, con el Distrito de Salud, también existen otros lugares donde se llevan a cabo las pruebas. La Guardia Nacional, al número 512-883-2400, la Fundación Coastal Bend, al 356-9572, la farmacia CVS al 814-8305, la clínica Amistad al 884-2242, así como Physicians Premier y Christus Promptu Urgent Care Center.
Annette Rodriguez, Public Health Director. Information in today's world moves very fast, but we must be really careful with fast information, as sometimes it can be unreliable. Just because you shared something that sounds correct doesn't mean it really is. The best place to get COVID-19 information is going to be the CDC website, the DSHS website, or the cctexas.com/coronavirus website. Early on, we all heard that you really did not need to wear a mask when out in public. Many of us had seen China and other countries wearing masks. So why are we getting so much mixed information from everywhere? We can all agree that social media is fast information, fast videos, but sometimes the information is not accurate. Some of these shares incorrectly state that this upper viral infection does not exist, or the shares make the viral infection as a downplayed event. But on the contrary, this is very real and easily transmissible. Nurses, doctors, the health department, and your leaders can all assure you that it's real. The 4,000 plus COVID-19 people here in Nueces County that have suffered with critical symptoms of COVID-19 and are lucky to have survived can also reassure you that it's true. I am here to tell you that Nueces County citizens can break the chain of this infection. Public health is screaming prevention messages on the top of our lungs. The public is picking and choosing selectively what they want to hear. A great example that I cannot stress enough is just because you have a mask on, that does not mean that you're allowed to be close to each other. While we did say that if you were out in public and you knew that a place had a lot of people, you should wear a mask, we never said that wearing your mask allows you to forego the social distancing. Let me see if I can explain. While a mask does offer some protection, it is not the same as the protection that is given to our healthcare workers. The healthcare workers are fit tested for proper fitting of a medical N95 mask. The N stands for NIOSH, the 95 is 95%. It protects you from those airborne particles. The ones that the public wears are usually made of cloth and are not fit tested by any standard. So while this offers some protection, it is not foolproof. Therefore, if you accidentally get near someone who is also wearing a mask, as soon as feasible, move back into your safe zone that is 6 or more feet away from other people. Why am I wearing this mask? Is this level of mask needed currently? No, not in this setting. But I'm wearing this mask to see if it will help to give an understanding of the proper use of a mask. So I think I have clearly demonstrated that this mask would give a lot more protection than this mask. This mask is a homemade mask. If I sneeze with this mask, there's a lot of room for wiggle. There's a lot of room to actually go on to somebody else and get them sick. This mask, if I sneeze, it stays inside this mask. This mask is properly fitted for my face, and so this is a fit-tested mask. The ones at the hospital don't look quite as scary as this. They're the N95 mask, but they have to be fit tested. They actually go into a box, and this box is an anti-room where they spray them. And if they can actually taste the taste that they're spraying, then they don't have a proper fit test. And they have to step out, they have to change the mask, they have to properly put it on again, they have to try again until they get a proper fit. So their masks are very different than our mask. And so I want to remind people that it's twofold. It's not just wear a mask and then you can congregate close to people. It's kind of like when they send you home from the hospital and they say, you need to do wound care. You need to wash your hands and you need to clean your wound and you need to change your gauze and have a clean gauze. They're not saying, well, just wash your wound. They're saying, wash your hands, clean your wound, and change your gauze so you have a clean gauze. It's all three of them. So again, wearing a mask and social distancing or not, or they're complementary to each other. You have to wear a mask and you have to social distance. You have to wear a mask and wash your hands. You have to wear a mask, social distance, and routinely wash your hands. None of these instructions are one or the other. For those that have never had an issue speaking up, this is your time. You're going to be happy by what I'm going to tell you. But for those that are more reserved, now is the time to speak up. I can assure you that you are not going to be considered rude if you ask someone that is wearing a mask, if they come too close to you, to step back, to move 6 feet back. If they do not take your health seriously, then you should. This is your health. Alternatively, if they do not back up, then you should move at least 6 feet away from them. 6 feet is much further distant than many of us realize. I have today my 6-foot ruler to show everyone just how far 6 feet is from someone. That is a 6-foot distance. So a lot of times you hear people say, an arm length. It is not an arm length. My arms are not 6 feet long. So 6 feet. And the further you can move away from other people, the better off you are. Thank you. Another point I would like to make is if you are exposed to someone who is a confirmed positive COVID-19, you have to quarantine immediately for 14 days. Utilize a buddy system if you live alone. Ask someone else to be your buddy to help you with groceries so that you don't go into a store and possibly expose others. Download an application to get food delivered contactless. There are many options out there now. If you feel sick, inform your supervisor via telephone. Don't walk into their office and tell them you are sick. You will end up exposing them as well, and if you come back positive, they too will have to be quarantined. So why do we ask that you quarantine? For one, it's mandatory. For two, quarantine is used to keep someone who might have been exposed to COVID-19 away from others. Also, quarantine helps prevent the spread of disease that can occur before a person knows that they are sick or they are infected with the virus without feeling symptoms. What is considered a close contact to a COVID-19 positive person? If you are within 6 feet of a COVID positive for even a short duration of time, that is considered close contact. If you provided care to a sick positive COVID-19, that is considered close contact. If you had direct physical contact with the person, you touched, hugged, or kissed a COVID-19 person, that is considered close contact. If you shared eating or drinking utensils with the COVID positive person, as well as if a COVID-19 positive person sneezed or coughed on you, that is considered close contact. If any of the above applies to you, you should be in quarantine. Stay at home for 14 days after your last contact with the person who has COVID-19. Monitor your health for fever, anything over 100.4, coughing, shortness of breath, headache, flu-like symptoms, or other COVID-19 symptoms. Now it's the time to always practice good public health strategies and continue to make responsible choices. Today we did have a drive-through, as City Manager Zanoni mentioned. I wanted to tell everybody that we actually had 207 people that went through our drive-through. 91 tested positive. That's a 44% positive rate for our drive-through. That is very concerning. So tomorrow, because we did not do the complete 200 on Tuesday, nor the complete 200 that we had scheduled for Wednesday, we have some VTM, very little left, but we have some. So we are having another drive-through tomorrow. So we're having a lot of calls, a lot of people. We have about 500 to 800 people every day calling, wanting to go through our drive-through. So we will have another drive-through. So we don't want to keep any supplies in our possession if we can actually utilize them for the community. So I wanted to make sure that everybody knew we had a drive-through. 207 people went through, 91 came back positive. It's a 44% positive rate. So help our hospitals to recover their COVID-19 patients and not to continue to add more patients to their already demanding numbers. Stay healthy, stay strong, and as always, stay informed. Thank you.
En resumen, la información en el mundo de hoy se mueve muy rápido, pero debemos tener mucho cuidado con la información rápida, ya que a veces puede no ser confiable. El mejor lugar para obtener información sobre el COVID-19 será el sitio web de los CDC, el sitio web del Departamento Estatal de Servicios de Salud o la página web cctexas.com/coronavirus. Al principio todos escuchamos que realmente no necesita usar un cubrebocas cuando está en público. Muchos de nosotros lo hemos hecho desde países como China y otros países que usan cubrebocas. Todos podemos estar de acuerdo en que las redes sociales son información rápida, pero en ocasiones la información no es precisa. Algunos de estos recursos compartidos afirman incorrectamente que esta infección viral superior no existe, o hacen que la infección viral sea un evento mínimo, pero por el contrario, este es un virus real y fácilmente transmisible. El hecho de que tenga un cubrebocas puesto no significa que le permite estar cerca de los demás. Si bien dijimos que si estabas en público y sabías que un lugar tenía mucha gente, deberías usar tu cubrebocas. Nunca dijimos que usarlo le permite renunciar al distanciamiento social. Si bien el cubrebocas ofrece cierta protección, no es lo mismo que la protección que se brinda a nuestros trabajadores de atención médica. Los cubrebocas N95 están diseñados y ajustados adecuadamente. Las que usa el público muchas veces están hechas de tela y no están probadas por ningún estándar, por lo que si bien esto ofrece cierta protección, no lo van a proteger al 100%. Para aquellas personas que nunca han tenido problemas para hablar, este es su momento, pero para aquellos que son más reservados, ahora es el momento de hablar. Te puedo asegurar que no está siendo grosero si le pide a alguien que está usando cubrebocas que retroceda 6 pies. Si está expuesto a alguien que es un COVID-19 positivo confirmado, debe ponerse en cuarentena inmediatamente durante 14 días. Utilice un sistema de amigos si vive solo. Pídele a otra persona que sea su amigo para que lo ayude con sus compras para que no entre a una tienda y posiblemente exponga a otros. La cuarentena se usa para mantener a alguien que podría haber estado expuesto al COVID-19 lejos de los demás. El día de hoy se llevaron a cabo 207 pruebas, 91 de ellas resultaron positivas. Esto es igual al 45% de las pruebas que resultaron positivas el día de hoy.
Thank you so much, Barbara Canales, Nueces County Judge. You know, when I was a young girl, I liked to run, and I was never good at the long distance running. I always liked sprints, and that's kind of almost been a metaphor for my life. I like doing everything fast. I talk fast, I work hard, I work fast, I want to solve problems fast. And what I recognize today is that fast isn't going to work here. This is a marathon, not a sprint. And everything we're doing here needs to be carried forward like we're running that marathon. And I know you're tired, because I'm tired. I'm tired of saying the same things. I'm tired of delivering bad news. I'm tired of, quite frankly, the situation not improving. So I feel for all of us together. But you know what happens when you get tired? You need to recharge. You need to take a breath. You need to step back. And you need to catch our second wind. We need to catch our second wind and change the direction of what's happening to us here in our community. And if you don't believe it's real, I'm going to do everything in my power to prove to you that it's real. Because our hospitals are every day accumulating a massive amount of patients, so much so that our hospitals are no longer regional healthcare hospitals. They're regional COVID-19 hospitals. Our ICU's occupancy rate is going higher. About the only thing that stayed steady, thank God, is our ventilators. They've been about 44 almost the last 3 days. But that can change at any moment with all of the increased ICU capacity. So today I'm going to focus on a few important messages, some of which you've heard before. It's like a marathon. We're going to keep running those laps until we cross that finish line together. So earlier today, Governor Abbott issued a proclamation amending the GA 27, and what he did was he added to the list of counties where non-elective surgeries are prohibited. And I want to direct your attention to the map on the board. Now, Nueces County was already added to this list by proclamation last week, but the surrounding counties in our trauma service area that are overseen by the RAC, that's the Coastal Bend Regional Advisory Council, have also been added. This map is shown in, see, I wore this color so we wouldn't get confused. It's magenta, and it's exactly the color on the map, okay? This is our area. These are the people that are our neighbors. This is who we serve here in Nueces County because we are a regional healthcare center. And I want to show you this because it really underscores the fact that much of our state is experiencing tremendous increase in positive tests, as I said, hospitalizations and vents, and sadly deaths. And the restrictions that the governor places on elective surgery is designed to make sure that we have capacity for essential surgery for our COVID-19 patients and for emergencies, like regular, things that happen in life. There could be a multi-car accident, and it can overwhelm an already stressed hospital. Or we could have a fire in our region, in an apartment complex, or an industrial accident. And yes, a hurricane. And so I want to remind you what I said last week when the governor added Nueces County to the list of counties which could not perform elective surgeries. I want to make sure that you are communicating with your doctors. We know that when this ban was implemented earlier this year, many patients stopped getting treatment and they heard no procedures and they canceled appointments and they assumed that their condition was not life-threatening. Sometimes conditions get worse, and this is not the intent of this rule. And so the rule is designed to help ensure we have enough hospital capacity to take care of these COVID-19 patients. I can tell you that Christus Spohn has 55% of its hospital census in COVID-19 patients. And so we don't want any of you to stop getting treatment that you need, but we want you to discuss the condition with your doctor. But this highlights what's happening to us. And I think that it's absolutely critical that people understand that it's causing us harm because we can't do all the procedures that we need to do. And it's not just here in Nueces, it's in our entire region. This region in magenta, purple, pink, purple, is in crisis. So I think it's very important that, we understand the urgency of the situation here in obviously South Texas, but this shows you all of South Texas. I mean, look at that. Look at all the red. So I'm very, very grateful for my fellow elected officials because they understand this urgency, and I've been on the phone all day with senators and congressmen and other electeds, and I'm grateful for all the support we've received because all the resources that we've asked for, we have had some success this week in receiving testing supplies, and we've actually been told now that with medications, we're now going to let the hospitals pursue directly with the vendors. So we're no longer going to be going straight to the state. They want the hospitals to go straight to the vendors. And, that could create some issues, but we are going to work through them. And part of the reason we've been so successful as a team here in being proactive is because we do ask for what we need. And I don't know about you, but this is where being a female is good. I don't mind asking for directions. And that's what we do when we get into trouble. We want to know how the state wants us to act so that we can be guided into these requisitions that we need so much. And so when a STAR request comes from Nueces, it's a genuine need, and they know that at the state. They know when we call, we're not asking because we're trying to build up our pantry. They know that I'm calling because there's a genuine need. It's not a wish list. And they do what they can to make sure because they know our needs are real. And I want you to understand the STAR requests that we've made recently, so I preface it that way. I've gotten a lot of questions from reporters, so I want to make sure that I address it. And I'm going to warn you, you know how on TV they say, what I'm about to talk about is upsetting. And so if you don't want to hear this, I need you to walk away right now. Because what I'm about to talk about are things that are unpleasant. The county medical examiner has requested, and I have forwarded this request to the state for a FEMA mobile morgue unit. This is essentially a refrigerated trailer which can house the deceased when we are at capacity in our own morgue. And our own Nueces County mobile morgue unit cannot handle it. This is where we are right now. The sudden spike in deaths has created this need, and not every death requires an autopsy or our medical examiner services, but some do. And by law, there are certain types of deaths that require the county medical examiner to conduct an autopsy and determine the cause of death. And yes, they are handling COVID-19. And yes, COVID-19 can survive death. When the cause of death is known and is certified by the attending physician on the death certificate, and it is of natural causes, including coronavirus, it's not necessary. So that means that not everybody who dies of COVID-19 needs to go to the medical examiner. There doesn't have to be an autopsy. And again, these are unpleasant topics, but these are the issues of our day. We have a duty to the deceased, and not more just the duty. It's an obligation to do what's right for the dignity and the sacredness that we hold in esteem, to be the stewards of you in life and in death here in this county. And so to the community, we carry out this commission, and if additional equipment or supplies are needed, I have to help get that too. It's no different than when they ask me to get medicines, than when they ask me to have these types of, supplies for the medical examiners. And we're also working with our hospitals to ensure that the medical examiner's office is conducting the autopsies when necessary and when not necessary. That means we work with the hospitals, we work with assisted living homes, and we work with hospice. And I believe that we are doing a good job to provide the dignity and the respect that's required for the deceased. And when the body of the deceased is released to the funeral home of their choice, we're doing so in accordance with the wishes of their loved ones. This is also difficult, but I need to let you know that we've also requested body bags, and where I told you earlier that we have a reputation for asking for only what we need and nothing more, this is true. This is not in an effort to be sensationalistic or dramatic, but I have been asked many times today what we place star requests for, and I promised you that I would not lie to you. So I will tell you when we need to be cheerleaders, and when we've done well, and when you have done well, and when we've all flattened the curve, we were here celebrating that good behavior together. And then when we had moments where we needed to be reminded what we needed to do, like July 4th weekend, we were referees, not cheerleaders. And so when I tell you that these are the requests that we've made, it's because this is the ugliness of this virus. And so we have, in the abundance of caution, we have ordered our projected need and also made certain that we have all of the supplies that the medical examiner's office has given to us. And I'm also helping our hospitals to get, more staffing. So CBRAC will receive the staffing request, and we push in the emergency management team. And so I think I might have mentioned this earlier in the week, but it's good to know that help is coming. Over 16 members of staff going to CCMC and 40 to Christus Spawn, and another 40 to be deployed that are actually should be here on the ground, if not today, early next week. And so all of the elements that are part of emergency management are part also of the STAR request system. And so we will continue to get what we need, and we have to do so because you'll have to remember all of that talk about flattening the curve. Well, this was to help avoid a spike that would overwhelm our capacity. So we haven't achieved that because our capacity has increased and the spike is here. And now it's time to make that peak come down. We almost are at the precipice, but I'm sad to say that the projections show that we are not at the peak yet. So the next 2-3 weeks are critical. If you don't want a summer that's full of this kind of bad news, then we must do everything we can to take this seriously. I know that we can all raise the bar together so that we can make sure that we can flatten that curve and give us back that additional capacity. So our friends in the Rio Grande Valley down here, they hit the breaking point some time ago, and they had to issue emergency stay-at-home orders. They had to issue shelter in place because it was that grave of a scenario. I don't want that to happen to us. That was their reality and their facts on the ground. But we are running close to being out of capacity, and we will have to take stronger measures. And so I need everyone to do their part so we can stay healthy, and I want all the sick to recover so that we can make certain that you become COVID-19 survivors. And of course, the best part is that you can also donate blood if you have recovered from COVID-19. This, of course, is the convalescent plasma therapy, and there are so many opportunities. If you'll get online to coastalbendbloodcenter.org, you can get more information and more ability to save 2 lives with your donation and gift of life. I want to thank you all for all of those that have donated, and I know that we've had over 70 donations already. Let me just conclude by saying that there is always so many things to highlight. Annette tries to do her best to talk about the protocols. She talks about the opportunities that we have to do the right thing, and she gives you the harsh realities of what happens when you don't. Peter comes and he gives the statistics every day so that we can show how the graphs are progressing. I try to bat cleanup and try to give you a little bit of both encouragement and a big dose of reality when you need it. I am not sure anymore what I can say to impress upon you that will really make us call our neighbors, the family members, the coworkers, anybody you know that's not doing this, not preaching it, not living it, not walking the walk. But I'm going to ask you, for the sake of all of us, to do that today. I don't have to tell you what the list is. You already know it if you're watching this. You need to help me spread this message. I am confident of one thing, and that is that if we do it, and if we do it simultaneously together, the result will be good. And if we don't, then we're going to be Groundhog Day tomorrow. And I'll be back up here at this podium with the same message, and Annette will have the same protocols, and Peter will keep watching his charts go up and up. So let's wake up from this nightmare, and let's create a new reality for us. Right now, let's do it today. Forget all the good that we've been doing before. Let's start new today. Are you ready? Because I know I am. I'm ready to get even more serious about everything that we've been preaching forever. I'm ready to go 10 feet apart if that'll help. Join me, won't you? Because the future of our health care for our region depends upon it. My hope tomorrow is that I bring better news. Thank you, and I stand ready to answer your questions.
En resumen, hoy temprano el gobernador Abbott emitió una proclamación modificando su orden, agregando la lista de condados donde las cirugías no electivas están prohibidas. El condado de Nueces ya fue agregado a esa lista por proclamación la semana pasada. La restricción de la cirugía electiva está diseñada para asegurarnos que tengamos capacidad para la cirugía esencial para nuestros pacientes con COVID-19 y para emergencias. Esta regla está diseñada para ayudar a garantizar que tengamos suficiente capacidad hospitalaria para atender a los pacientes con COVID-19 y para ayudar a las personas que necesitan tratamiento para otras afecciones. No queremos que las personas dejen de recibir tratamiento. Una gran parte de mi trabajo es obtener los recursos que necesitamos durante esta pandemia. Esto ha abarcado desde equipos de prueba y suministros de prueba hasta medicamentos y equipos de protección personal. Quiero agradecer el apoyo que hemos recibido y los recursos que nos han brindado. En cuanto a los fallecimientos, el médico forense del condado ha solicitado y ha enviado la solicitud de una unidad móvil de la morgue. Esto es esencialmente un remolque refrigerado que puede albergar a los fallecidos cuando estamos a capacidad de nuestra propia morgue y nuestra propia unidad móvil de morgue del condado de Nueces. El repentino aumento de las muertes ha creado esta necesidad. Hemos pedido bolsas adicionales no porque esperemos que esta ola empeore, sino para asegurarnos de tenerlas a mano. En cuanto al personal médico, también estoy ayudando a nuestros hospitales a conseguir más personas. He solicitado más enfermeros. Hemos solicitado 16 empleados del Estado y tenemos ya 40 en Christus Pond. Asimismo, hemos solicitado que se implementen otros 38 más. Necesito su ayuda para reducir la necesidad. Las próximas 3 semanas van a ser críticas. Necesito que todos hagan lo que puedan para frenar esta propagación. El área del Valle de Río Grande también llegaron a un punto de ruptura. Cuando nos quedemos sin capacidad, tendremos que tomar otras medidas más enérgicas y nadie quiere hacer eso. En cuanto a la donación de sangre, han habido más de 70 donantes y les quiero agradecer. Ya no sé qué más le puedo pedir para aquellas personas que no están haciendo su parte, pero le voy a pedir que lo haga. Diseminen la información, así tendremos mejores resultados o el día de mañana vamos a repetir todo nuevamente. Comencemos otra vez hoy y sea serio con su responsabilidad, ya que el futuro de nuestra salud depende de ello.
All right, that concludes our briefing for today. That concludes our briefing for today. We will see if there's any questions from the media. Either the judge or Annette or myself.
I guess either for you or the judge. I guess earlier today, El Paso asked their schools not to open until September, and we were curious if the city or their county was considering asking schools to maybe postpone opening.
Like swimming pools you're talking about?
No, schools.
What? Schools. Okay. Sorry, between our masks, yeah, we can't talk right here. Schools. So the city or the county doesn't have jurisdiction over schools, but I was speaking with the mayor today. He and I were meeting, and we're going to get the judge involved too, but we do need to sit down with all superintendents. I encourage the mayor to do that today. They are bound by the state, TEA, Texas Education Agency, and we've seen the president on TV in recent days as well, encouraging certain action. So locally, we have to have a conversation with our school districts. I know I have 3 children, but 2 who go to school. And so as a parent, I'm concerned and want to know what is the plan. And I suspect the superintendents are as well. So it's not really answering your question directly, Courtney, but we will in the next week or so, or sooner, have a conversation with the superintendents, especially Dr. Hernandez from CCISD, the biggest school district in the county. But there's 6 or 7 school districts here, and so each of those superintendents, we're going to see if we can do some type of conversation to figure out how do we proceed forward with that very important question. And Judge, I don't know if you want to add to that.
I would echo everything you said, except for that from the rural perspective, I'm going to reach out to them. Well, they've already been reaching out. I spoke with Tolosa Midway this week and also Driscoll. And so some of our smaller communities, their plan is going to be different than, let's say, a school of 2,000. So what I've recommended is that we get together on a Zoom meeting and we are going to talk about it, what their concerns are, and we are also going to create a list of questions that we can take to TEA because, every school region is so different. I mean, if we're in a hot spot like this, it can't be the same as if you're in West Texas County that's doing really well with under 20 cases. So they have a lot of questions. We asked them if they would please write them down, and so that's how I'm going to try to help, the rural areas. And Annette's been great. When we've had a situation where, we needed a plan for a company, she's helped them come in and formulate. The Education Service Center, number 2, has already asked her to come and speak to, has that happened already? Okay, so it happened today. So today she spoke to them. So obviously education is where we're headed next. That's our next big issue. And I'm still concerned, about those that cannot go to school during this time because they have some sort of a compromised, a body and some immunosuppression that would need, so there needs to be online learning available, in my opinion, it's in some levels for those kids that cannot go because of, they have a chronic health condition that would just, be terrible for them. So it's going to be very difficult over the next few weeks, but I'm going to start first, Courtney, with those schools that are year-round because their calendar is coming up quick. So I need to focus on where those schools are and then at least give us some more time to work with those that we're going to start at the end of August. So I'll be looking to visit with all you year-round schools first. Yeah.
Governor Abbott is continually asking counties to enforce masks.
Right.
Are there any plans we have to try
To enforce masks? So, obviously, we're rule followers, not rule breakers. We want to follow the rules and we want people to follow the rules. So is enforcement available to us as a tool? Yes. Is it meant to be punitive? No. You'd have to be just kind of belligerently reckless about it. But I do believe that enforcement's necessary, and that's why the governor gave us that tool. And so I believe our law enforcement agencies know what the rules are, but it's just like speeding, are you going to get a ticket every single time, or are you going to get some warnings? So there might be times, and I've also cautioned people, if you see someone that's not wearing a mask, before you get angry, first of all, move away from them. Don't be close to them. And second of all, it could be that they have a health condition that prohibits them, okay? So don't jump to the conclusion, but definitely allow people who are in a position to be enforcers to do so. And I think that's probably the rule of thumb. I'm going to say this. I see a lot more people wearing masks. I really don't see people not abiding by the rules, at least in my, circle of courthouse to HEB, to Stripes, to CVS, to all my little haunts. But I think that we're doing a better job. And I still think that there's pockets of groups that need reinforcement, is how I'm going to say it. They need reinforcement. To my knowledge, no tickets have been given.
I do have a question for Annette. Yes, yesterday, I believe during the city council meeting, you had mentioned that there had been several people who died of COVID-19 at home. Could you maybe elaborate on these people that had received treatment? How did we know that they died of COVID-19 related illnesses?
Okay, so the question is to elaborate a little bit on the people that died at home. And so we actually get calls, like notification from family members that they had a loved one that passed from COVID-19. And then we validate it. So we look to see if they had COVID-19 and the date that they were positive and, what the cause of death was, if they know that at that point. So this is very unusual for us to see this. I think in the 22 years that I've been here, maybe I've had just a handful at the most of people that have actually died at home. And those were just strange circumstances. So to see 2 or 3 in the last couple of days is, again, very concerning. I also had a call from the region today that they had 1,000 positives in the valley today, just in one day. So they are doing military testing out there, but very concerned for our co-workers down there, Dr. Olivares, as well as Esmer, because, these individuals are fighting very hard also in public health to try to keep as many people safe and save lives. And so it's very disconcerting to see the number of positive cases go up like that. So.
The jail annex?
What was the question?
Do you happen to have an update on the outbreak that happened to the jail annex at all?
So,
Yeah, I'll just share with you that we are testing inmates and plan on testing inmates that had, direct contact. And also, it's really important to note that we're going to be testing people who have a very high risk diagnosis. So they might have hypertension, diabetes. So we've really done some testing today to make certain that inmates that would have some sort of a comorbidity associated with their health history, that they've gotten testing. But we are working towards testing hundreds of staff members. I don't have the exact number, but we will be testing staff. We will be testing more inmates. And I think this is a very positive thing because the more we can isolate and we can stop the spread of this virus. So that's my update. And I thank everybody that's really working on this tirelessly. It's a huge endeavor, and we have a lot of cooperation from Nueces County Jail, the sheriff, and the medical administrator there on site. I just want to say something too. I get, we had a lot of topics, but just want everybody to know that our hospitals are expanding ICU beds as much as they can. So I don't want you to think that we're sitting here waiting for something terrible to happen. It's the opposite. Krista Spahn has been implementing alternate care beds, sites, if you will, constantly during the spike. So we've moved from 24 COVID beds from the beginning to over 168 beds, and I think there was another 30 that was going to be added today. And so I just want you to know that every time we see these spikes, we continue to add capacity. The same is true for HCA. I've talked to both major hospitals today, and they're adding lots of beds. So I want you to know it's not, we're not at that point where, we're not at the breaking point. We're getting there, but we have done so many good things to help address this situation. But there is a point where you cannot add any more because it compromises health care for everybody else. And I do want you to know that we've moved from this to this. We've had surge plans built, and then we've said modify, and then we've modified again and again and again. And if there's any way to put more beds in the hospitals, I promise you, after talking to the two CEOs today of the two major hospitals, they are going to do it. So, there is a lot of hard work and goodwill and tremendous effort being placed to convert rooms that were not ICU into ICU beds.
Okay, do we have any other questions? Okay, that does it for today, for the media questions. So we want to thank the media again for covering this and thank the community for watching. Tomorrow is Friday, and we'll have most of the time devoted beginning at 5 o'clock for our Dr. Bird from Texas A&M Corpus Christi and his team that comes here. One of the things we do is answer questions at the end of his presentation that are posed on Facebook. And so it's a live interactive forum for persons watching. You can get information back as you do during the week, but even more so on Friday. So we look forward to hearing Dr. Bird's presentation. I know he's been busy, been out and about this week, at least through WebEx, doing numerous interviews in some of our channels here. And he'll have his projections and graphs and travel patterns through telephone data, cell phone data updated for tomorrow. So we look forward to seeing everybody tomorrow. We'll be here at 5 o'clock with that presentation. Thank you. Good evening.